Thank you very much, and everyone for joining us today again for this wonderful session. We're very pleased to be coming almost to the last mile of the course, and it's been very, very interactive. So today we'll be looking at integrative lifestyle medicine in health. So as we do so, please let's take note as usual and share. So what I'll briefly do now is just share what we are expected to learn today. And I will go. Yes, I will go with this. I don't know if you can see my slide.
Yes.
All right. So we are learning of interactive medicine in health. And like the course outline format, we've done pre-test. So we'll do post-test. So please, let's get ready for that. In the session today, there'll be question and answer. And we'll just be happy that everybody will take part in it. Feel free to put in your questions in the chat room. And the whole person final project, we've been talking about it. We'll have more chance to elaborate on it in the next 1 or 2 weeks. And to reassure us that we curated the best from the globe, the best faculty to be with us. So thank you very much. These are the details of the final project. Like I said, we've been talking about it. So let's just get thinking about it so that as we reach the end of the lectures, we'll be able to ask many more questions. If you have your research topic or what you want to write about, please feel free to send it to the email here to Ayush and Kenneth. They'll be able to send your request to your topic to the right person. So thanks for being with us. And I can't wait for our last lecture, which is the summation of everything, leadership systems and AI for whole person health. This is very important, and we'll be having Prof. Wilfred Ngwa, Stephen Avery, Cortland DeVille, and Dr. Khan to add value to this. So this is a session you don't want to miss. So thank you very much for listening. And as part of our housekeeping, please, when you are not speaking, please mute your phone. We are recording. And if you have problems, not problems. If you have questions, please put them in the chat room and we'll just look through them as we go. Thanks again. Now it's time for me to introduce our speaker. Yeah. So, it's a great pleasure. Let me go to my initial slide. All right, here we go. I intentionally brought this slide because I won't be able to pronounce all her degrees and accomplishments. But it's a great pleasure to introduce my colleague and a friend in the person of Dr. Yemi Abola. She is an experienced and dedicated nurse practitioner with several years of experience with robust background in acute and chronic case management, specializing in high volume, fast-paced healthcare settings. She has a proven record of providing exceptional patient care across diverse populations, including urgent care observational units and outpatient clinics. She's also skilled in diagnosing, developing treatment plans, and performing a wide range of medical procedures. She's adept in leading multidisciplinary teams, initiating timely referrals, and ensuring effective care coordination. She's also has a strong expertise in clinical leadership, patient education, and mentoring, with the ability to consult independently and optimize healthcare delivery. She's also very, very passionate about advancing patient outcomes through evidence-based practices and innovative care. And I know the other thing about her is that she's an avid learner. When you talk about passion, dedication, commitment to learning new knowledge, you have that packaged in Dr. Agboola. And I was just looking through her bio and her LinkedIn page, and she just got a certificate in what is generative AI last month. She's just learning, and it's a great pleasure. I've known her in other marketplace, not just in academia, but in civil society, in Christian education settings. So it's with great pleasure I invite Dr. Yemi Agboola to speak with us today on integrative medicine. Thank you. I'll stop sharing.
Good morning, everyone. Thank you so much, Dr. Epo, for that introduction. It's such a pleasure and honor to be here today. So wherever you're watching from or listening from, I want to say good morning or good afternoon. I am so thankful for the opportunity to be here and just, the great work that the coordinators of this program, the great work that they've been doing. I've been coming except for last week because I had a scheduled conflict, but the wealth of information that we're getting here, it's second to none, and it's so timely. So I'm thankful to be a part of it and the little that I can contribute in addition to everything that we have been learning. So today, let me go to sharing my screen. Excuse me, I know that I had it up. Thank you. Today, as we have, we just heard, we will be talking about lifestyle medicine and integrative health. Lifestyle medicine and integrative health. Right from the first meeting, I started hearing, even when Dr. Kenneth was talking about salutogenesis, about pathogenesis, I was like, yes, let's go for this, because it's basically what we will be talking about. Excuse me there. All right, I want to make sure you are seeing the right screen that I want to share. Okay. All right. Okay. Are you seeing my full screen or the presenter view? I want to make sure you're seeing just the full screen. Please help me, give me thumbs up. Which one are you seeing, one or two? All right, great, thank you. So, lifestyle medicine and integrative health. And like Dr. Epo just said, I just love to learn. And in fact, I got myself, I think it was last year that I came across this term, and I'm like, what is lifestyle medicine? What is integrative health? I really want to get into it. So I started working on that, to get certification in that. So when this topic came up, I'm like, I am on the right track, because this is where healthcare is going now. All right, so lifestyle medicine, integrative health. I'm going to skip a few slides just because of time. But our course objective today will be explaining the foundational principles of lifestyle medicine. We'll look at the psychological mechanisms, evaluate the evidence for complementary modalities, and assess our patient using the holistic approach that we have been hearing about, and also being able to design a personalized lifestyle intervention. And at the end of all, be able to apply this. And in order for us to shift from where we used to be, the way medicine and healthcare used to be, there's got to be some shift in our viewpoint. There has got to be some paradigm shift. So we look at the continuum of wellness. We've got to go from to a place of understanding that health is not just an absence of disease, but it's a dynamic state. It's a place of salutogenesis, which we'll talk about in a moment. It's a place of dynamic dynamic state of physical, mental, and social well-being. We want to look at how the environment, the genetics and lifestyle, how these interact together and intersect, and also talking about epigenetics. All right, so pathogenesis, as we have heard, he focuses on the origin of disease. And if we look at our healthcare system, I call it the sick care system, because really that's what we're doing. We wait until people are sick, at least for the most part, and then we're dealing with those diseases. But that is not how it's supposed to be. So Aaron Antonovsky had coined this terminology, salutogenesis, which focuses on the origin of health and well-being rather than looking at the origin of diseases. You know, sometimes it's like what you look at, for the most part, you become that, right? You know, when you're constantly talking about the patient comes to the clinic and what we're telling them is, you know, about how they are diabetic, how they have high blood pressure, and all of that. That is what is in their brain. They live thinking about those things. They live burdened by those things. So we want to go from that to a place of knowing, you know, how can you stay healthy and be healthy, right? So we're looking at the body as an ecosystem where everything works in congruence, where if we remove the impediment and add the requirement, everything will go right. And then how the lifestyle choices, the food we eat, how things happen, even with our genetic expression without changing the DNA, and how all of these things influence our risk for healthcare problems. I look at these staggering statistics, and it's really mind-boggling to see that over 76% of US adults have at least one chronic condition. At least over 50% have at least two chronic conditions. And when I'm talking about that, I'm not talking about just sinus infection. You know, you're talking not chronic sinusitis, talking about high blood pressure, heart failure. This is going on in this society, which is the greatest country in the world, as we say. I mean, I don't know. I just pulled up United States statistics. I know there are other nationalities represented here. And look at the economic impact. It is huge. From 2024 to 2039, look at the cost that we are looking at. And if we don't do something, this is where we are heading. And what about the mortality rate? At least 7 out of 10 deaths is related to chronic diseases. And then, I mean, we've talked about that 93% of adults now, because I deal currently in my current role, I deal more with the geriatrics. So I'm very interested in geriatrics. So over 93% of adults that are 65 and older, they have at least one chronic condition. So how do we deal with this? That is why we are here, looking at the whole person health. All right, we've talked about some of these philosophy. Now, these are the pillars of lifestyle medicine. We're going to be talking about nutrition, physical activity, sleep, stress management, social connection, and avoidance of risky behavior. So let's go to pillar number 1, nutrition. When you hear about nutrition, most of the time we talk about diet, about how you use nutrition to not gain weight, don't eat fatty food because you don't want to gain weight. But what I found out is our first dose of medicine is nutrition. For even right from the beginning, the food we eat is supposed to be for healing. So it's not just the calories that we're counting that is fueling us, but it's a biological information. It's informing our genes. Every molecule we swallow is talking to our DNA. So, for example, a whole food, plant-based diet provides specific chemical signals that tells the body to downregulate the inflammatory pathways. So when you look at it, nutrition is actually the broad spectrum anti-inflammatory that we have. So I think when we have this understanding and we interact with the patient or with the individual, I'm saying patient, you know, for my line of work, but when we interact with the individual and explaining things to them for what it really is, we will be able to make the changes, to help them make the changes that they need to make with their health. So why does food matter so much? Every time we eat, we influence our gut microbiome and our gene expression. And 70% of your immune system is in your gut. As we're going, I like to be interactive, but because of time, I will not be stopping to ask questions. But if you found something that stood out to you, feel free to put it on the chat so other people can see it too. So when we eat, we are not just feeding ourselves, we are feeding these microbiomes. And, when we heal the gut, we also see different chronic skin issues, joint pain, even mood disorders begin to improve. So eating is beyond what we are just feeding ourselves. We are actually communicating with our genetics. We are communicating with the microbiomes in our gut. Look at this picture right here. So, excuse me. I don't need to explain that. It's right in front of you because of time. So let us look at the pillar number 2, movement. This is a big one. In our society, the exercise industry is a multi-billion industry. People, especially at the beginning of the year, people are looking, we have all these New Year resolutions. I'm going to hit the gym today. But let's go today and look at all those gyms. We are in March. How many people are still following through? And while we know how important exercise is, I think when we go deeper to see the power in muscle movement, it will help us to understand how this interact with our health, the whole person health. Let's look at it. The muscle is not just a part of your musculoskeletal system. It is actually an endocrine organ. When the muscle contracts, it releases myokines. And these myokines, they signal the distant organs, they cross the blood-brain barrier to act as natural antidepressants. So when these hope molecules, or we call them the hope molecules, when they travel to the brain, it leaves the mood, it causes the liver to improve insulin sensitivity. It is like a poly pill, like a one in all pill. It targets blood pressure, blood sugar, Alzheimer's. It clears the amyloid plaques associated with Alzheimer's and all of that. And so there is a reason why when we exercise, we feel good. When we exercise, we feel alive. So there is something that is going in our bodies, and I think gaining this understanding will help us when we are describing the reason or the importance of muscle movement. I'm not just talking about exercise, hitting the gym, but any kind of movement, walking, dancing, something that makes you happy. It actually does something, goes beyond building the muscle or looking good. So muscle movement is good for us. Look at this. Muscle contraction pumps those signaling proteins, as I mentioned, and it is a natural antidepressant. It lowers the inflammation. It promotes neuroplasticity. It increases resilience. It clears brain fog. It promotes angiogenesis. So when we are dealing with a patient, maybe the patient is dealing with obesity, and we're wanting to explain to them the reason why they need to move, it has to go beyond losing weight. It has to go beyond burning some calories. It's actually making the body to come to terms with itself, to be in a state of salutogenesis. All right. We already talked about this slide. I look at this. I think this one, we should all take a screenshot of this. I really like this slide. It's like a tug of war, like this seesaw between the myokines and the adipokines, the fat messengers versus the muscle messengers. When you're looking at muscle messengers, which we get from physical movement and physical activity, you get brain health benefits. It boosts the mood. It enhances learning. It increases insulin sensitivity. And on the other end, you're seeing what is happening when our body is just sitting there in a state of, we're just dormant, not moving. It contributes to chronic disease, and it also prevents us from enjoying the full life that we ought to have. This is another comparing screen. I will give us a moment to digest that. All right. So we talked about the vascular health. I want to kind of emphasize on that because that affects every single organ of the body. And a lot of the diseases we deal with, are you talking about Alzheimer's? Are you talking about congestive heart failure or diabetes, high blood pressure? All of these are related to our vascular health and elasticity of our blood vessels. So exercise, again, goes beyond just moving and building muscles. It really goes deeper. All right. Pillar number 3, sleep. If I can have somebody put that on the chat, sleep. It's a 5-letter word that evades many of us because sometimes we can keep driving our body. We just keep driving and we put sleep on the side. But I think when we look at it from this perspective today, I'm hoping that we will be able to make the shift that we need to make in order to have the adequate rest that we need. Here something just happened. I'm gonna stop sharing and I'll go back to sharing. All right. Okay, there we go. Awesome. Here we go. All right, I didn't need to stop sharing. So sleep is actually seen as a glymphatic rinse. We all have dishwashers in our kitchen for the most part. So there is a natural dishwasher that is embedded in us, in our system as humans, and that is sleep. Let's look at how this rinse works. So when we sleep, our brain cells shrink about 60% during the deep sleep. And so it creates the space for the cerebrospinal fluid to flow rapidly through the tissue, acting like a trash collector and gathering all the trash. And the waste fluid is drained through the lymphatic system out of our body for disposal. What is the clinical importance of this? The neuroprotection that we get from that regular rinsing. It protects the protein buildup. It clears lactate, another byproduct from all the time that we are awake, and all the things that we have been doing to us, stretching our brain and accumulating information and all of that. It actually helps to cleanse our brain. That is why when we sleep, and when we have a good amount of sleep, now this may be different for everyone. Some people do well with 6 hours. Some people need 8. Some people may need more. But you will know that sweet spot, that when you sleep and you wake up, you feel good. And again, it's not just the length of the hours of sleep, it's the quality of the sleep. Having a good environment where you can rest. Sleeping with maybe gentle music, some people will have their TV on and be sleeping. Your brain is still active, even in that environment. So having a calm environment that we can go into deep sleep. And in our technology, with the technological advancement now, there are things that you can even put on. There are watches you can wear on, rings you can put on that will track the quality of your sleep, if you want to try one of those things out. So there is a reason why when we sleep and get a good sleep, we feel really clear-headed in the morning. But when we don't get enough sleep, you wake up, you are foggy, you are in meetings, you are forgetting, you are dozing off. Now we know why. So I spend a little bit more time there because I think it's something that all of us can relate with. Chronic insomnia is not just a mood issue. It is a failure of the brain's primary sanitation system. So can we help our bodies and our brain to actually do what it's created to do? We can do that by going to bed in time and getting good sleep. Let's look at this comparing slide here. When we have healthy sleep, The brain janitor is able to do its work. The lymphatic system expands, the metabolic waste is removed from us. When we are not getting enough sleep, we could put our bodies in constant state of inflammation. I look at this gentleman in this slide, I'm like, nobody want to look like that. Unfortunately, many times we do. We cover it up with makeup though sometimes. But there is a reason, on a more serious note. There is a reason why sleep is instituted. There's a reason why we have night and day. All right, pillar number 4 is stress management. The HPA axis is like the biological stress commander. How does it trigger? You have the hypothalamus. When it detects a threat, it secretes the corticotropin releasing hormone, your CRH. It triggers the pituitary to respond to the CRH. Pituitary will release the adrenocorticotropic hormone, the ACTH, into the bloodstream. And triggered by the ACTH, the adrenal cortex pumps out cortisol. I went through that because we hear a lot about cortisol. Now you know how cortisol is originated in the body. Why is it related to stress? It is a natural response to stress in our body. Just sometimes, if you have something that triggers stress or a stressful situation, our body is created to respond adequately to this. But now on the other end of that spectrum is when our body is in a constant state of stress. When we are in a state of survival over the maintenance that our body is created to be in, it puts the body in a constant place where the blood glucose is increased, blood pressure is elevated, our mental alertness is impacted, it stops, decreases, slows down digestion, reproductive drive, and also the long-term immune surveillance. And I want to say, this is just an image that is describing that flow and the connection between the hypothalamic to how the cortisol is released. It is important, many times when you see someone, you can tell they are stressed, and we're telling them, just stop stressing. You are stressing too much. Well, that is not helpful. That is not helpful. Gaining this knowledge will help us to be able to address the whole person health. Why is this person having the stressful situation? Why are they in a constant state of stress? Our body is supposed to have like the on and off switch. Cortisol is supposed to be self-regulating. When we reach a peak level, it's supposed to stop that signal and bring the body back to baseline. But when we are in a constant state of stress, that is like you leave that cycle on. It's a loop. It keeps on going. It's stuck in the on position, and that leads to the chronic inflammation, the burnout, metabolic instability, PTSD, depression, anxiety that we encounter. So let us go to pillar number 5, which is social connection, loneliness, and whole person health. Unfortunately, we live in a world today that everybody is by themselves. Unless you go out to seek out a community, you may as well live in a city of millions or in a country of millions, it's a city of hundreds of thousands, and still be lonely. And some people may say, well, I'm just an introvert. I don't like associating with people. Maybe this might help. Of course, I'm not saying you change who you are, but when we are dealing with situation presented to us, we are looking at the whole person. Social connection is a part of this. Look at this first slide. The first point there, loneliness is a health risk comparable to smoking 15 cigarettes daily. That is huge. 15 cigarettes, well, I'm not a smoker, but you are lonely. You are not connected with any community. You are on the same track as someone that is puffing 15 cigarettes every day. That is significant. We are not created to be lone rangers. We are not created to live in isolation. When we interact, even from childhood, it addresses, it adjusts the internal weather of our body. It helps us, we stay connected. But when we are not, it keeps the body in a state of constant alertness. So when we're looking at a situation that is brought to us, we need to understand, is this person connected to a community? Is it a religious community? Is it maybe a community that they share the same interests? Family, what does their family background or their family situation look like? All of this we have to put into consideration in order to actually address that person holistically. Going on to pillar number 6, avoidance of risky substances. This is like the preventative anchor. Now, all the other 5 pillars we talked about, they are more of, okay, you can do this, you can sleep, move. These are things that we add to our lifestyle. However, the avoidance of risky substances is actually the subtraction, the things that we need to remove from our life, those things that sabotage our healing, that sabotage our state of salutogenesis. And the goal of this pillar is to unburden the body so that it can restore itself to the innate biological repair, to have the innate biological repair mechanisms functioning to the optimal level. Because we really cannot build a sturdy structure on a foundation that is constantly being eroded by toxins. Again, our world today, you've got to, learn to read the food labels. Sometimes the thing you eat food and you notice the change in your body, but you say, all I ate is just a piece of meat. But what is in that meat? What are the chemicals that are included in that? What the cleaning agents we use to clean our houses, the sprays we use, the environmental pollution in our environment where we live or where we work or where we gather in our society, in our communities. These can become biological saboteurs for our state of salutogenesis. Nicotine, we talked about that. Tobacco, smoking, alcohol. We know that for a fact that alcohol actually impacts the brain's lymphatic rings. The environmental toxins, the BPA and the plastic products that we use, the food that we eat that are ultra processed, they are so far from their original state that it's a shame in our communities today. The food, I think the other day, and now in the United States, now we have the Make America Healthy Again, and you will see different things comparing the food that we eat here, the food that is provided even at fast food restaurant, compared to those like in the United Kingdom. And you see the same food, but how much difference is when you put them side by side. So as we are dealing with the whole person health, we need to look at this as well, removing all the environmental contamination in their surroundings. All right, so when we're able to do this, we put the body in a systematic state of reset, where we can reduce the oxidative stress. The liver and kidneys, they can move from a constant state of they are all constantly detoxifying, but they can get to a place where they are doing the job they are designed for, to be able to regulate our metabolism. Immune regulation, neurochemical resensitization, all of these are tied to avoidance of the chemicals and those things that pollute our health. Now we move a bit further to the second part of our discussion, the integrative health. Now, the integrative health is like the bridge between our conventional medicine and the whole person health. So it's like blending the conventional treatment with the evidence-supported complementary approaches toward whole person health. So, for example, we discussed in lifestyle medicine all the 5 pillars. In conventional medicine, we use pharmaceuticals, surgery, we provide essential acute and chronic intervention. I mean, of course, this work hand in hand with that. We're not going to discount that because, things will happen. But integrative health actually allows us to use these evidence-based tools to move a patient from a disease state back towards homeostasis. So let's briefly look at some of the complementary modalities. Mindfulness-based stress reduction. Cortisol management. The physiological goal is to shift the body out of a pro-inflammatory state, out of a survival mode, to put the body in a place of reset, the place where the body can recognize, okay, I am on for too long, everything is okay now, let's turn this process off and calm down and get back to maintaining. It is actually possible. So some manual therapies that are out there, we have the massage. This is well known across the board. Chiropractic, osteopathic adjustment, interventions, all of these helps the body to begin the process of rest and digest. Shift the body from survival mode, where the HPA axis is in dominance, to a place where maintenance mode and we are in a vagal dominance. We have acupuncture, the traditional Chinese medicine, and the goal for this is usually to restore the energy flow. It's almost like a shift that happens in the body. It alleviates pain. It treats systemic imbalances. I think it was our third session under this program that our speaker spoke about phytomedicine, the herbal medicine, functional medicine. It uses the botanicals to support healing. We've already went into that, so I won't go. I didn't go deep in it this way. And the functional medicine, getting to the root of the disease. I want to make a comment there. This is what it actually looks like when I look at it. When the leaves of a tree is turning yellow or changing color, we don't just get a paintbrush and get a green paint and begin to paint the green. What do? We treat the soil. That is what integrative and functional medicine, what this is doing. Treating the soil, getting to the root, changing the root of the thing, providing the essential nutrients, removing things that are actually hurting that plant. And before we know it, things will begin to go the way they are. We begin to see the green leaves again. So contemporary medicine versus functional medicine, this is summarizing what we've been talking about. In contemporary medicine, we suppress the symptoms, we give acute intervention. In functional medicine, we identify and treat the root causes. In contemporary medicine, we focus on the organ. That's why we have so many, great specialists in the medicine world, in the medical world today. We have the cardiologists, the neurologists, we have the endocrinologists, and all of this because everyone is specialized. But in the functional medicine, we have a single integrated biological ecosystem that we are looking at as a whole and bringing it into congruence with itself so that it can function the way it is meant to. And functional medicine, it makes the patient or the person an active partner in their lifestyle change, rather than they're just receiving the prescription. They're just receiving, this is how much you take of this, and when you come next time, we adjust the dose. But no, I usually tell my patient, and my client, my coaching client, because I'm also a lifestyle coach and a health coach, I tell them your body is the greatest lab there is, because something that works for someone else may not work for you. So, and even when you go to see a doctor that has been in practice for years and years, that doctor can never know you as you know you, if I can use that term. As you know yourself, you've been carrying this body for decades. You know yourself. So it is important through functional medicine, integrative health approach, to put the patient in the driver's seat of their health because they know. All right, so acupuncture, manual therapy helps to reset the nervous system. The parasympathetic shift also happens we're going from the fight or flight to rest and digest state. All right, I'm going to move a little further there. So the whole person attunement, this is the goal, to shift the clinical focus, to go from what is this disease, studying the disease, what is diabetes, what it causes diabetes, how can we treat diabetes, to looking at who is this person in front of me. What are the life experiences that have brought this person to the state that they are, and how can we help them to navigate their life to get back to their original state? We look at their social connections, their sense of purpose, the environment. They are as critical as their blood pressure when they show up in the office. We're not just looking at their pulse, their heart rate. We are also asking them those vital questions, because that blood pressure you are looking at is actually signaling something that have been in motion. It didn't just appear that day in the hospital. That blood pressure is an interpretation of something that has been going on in that person's body. So instead of giving them medication to treat the blood pressure, we've got to walk them back to the root and help them to correct things from where it started. So the social connection, as we have discussed. All right. So let's look at this case study together. In this case study, we have a 52-year-old male, Mr. Marcus. Mr. Marcus is a high school principal, high stress, as you can say, dealing with high schoolers. You know that is a stressful job. Now he shows up in the office. He's having chronic lower back pain, persistent fatigue. He is in pre-diabetic state. His hemoglobin A1C is 6.2%. He only sleeps 5 hours a night. All day long, he survives on caffeine and processed snacks. He's sedentary. The only time he gets to work is the work that he goes to check on the teachers in the classroom, or going to the boardroom for meetings. And for him to be able to do that with his low back pain, with sleepless nights, he takes the daily ibuprofen, the Motrin, every day to just kind of help him get through the day. When he showed up to his general practitioner, they told him, Mr. Marcus, you are overweight. You need to lose 20 pounds. So what do we do for Mr. Marcus now that we have been under this study for the past 5 weeks? How can we help Mr. Marcus? How can we look at him as a whole person rather than a person dealing with prediabetes, a person that has a highly stressful job? Let's look together through the integrative strategic philosophy. What are the guiding principles here? Lifestyle change, lifestyle modifications. We want to shift the focus from looking at the symptom, managing the symptom, which is what he's doing, popping ibuprofen every day, which affects his kidney when this begins to build up. So not only his body is not resting, he's also putting chemicals that makes it harder for kidneys, for liver, for liver to do their job. So we're not just looking at his blood sugar, we're looking at the overall biological rhythm. Number one, looking at our pillars, we see that he has trouble with his sleep. He only sleeps 5 hours at night. It might be because he's hurting. When he goes to sleep, is it because you can't get in a good sleeping position, or you are just in pain? We look at the lack of sleep, which also increases cortisol, which raises his blood sugar. It also lowers the pain tolerance, and it lowers his pain tolerance, and also it makes his pain, it perceives pain more than it really is. So what else can we do for Mr. Marcus? looking at the nutritional intervention, moving from dieting to putting him on an anti-inflammatory nutrition base, right? So we give him high fiber food that can also help to reduce inflammation. And our expectation is to stabilize his glucose spikes, to reduce the chemical triggers that are associated with the back pain. And then the medication that he's using, can we try acupuncture instead of him taking Motrin, ibuprofen every day? That is a way to put all of this together. So when we do this, when we this example, we look at Mr. Marcus as a whole, looking at the environmental side of things, the things that is going on with his nutrition, not getting enough rest, the stress in his workplace. Another thing, we can send him to maybe therapy to get some support for the stress. How can he do his work better to reduce some stress? How can he delegate some duties? So this leads us to the conclusion of our study today. In conclusion, even though today's system is built for sick care, where we prioritize reaction over prevention, where we treat the immediate threats, trauma, infection, but we are losing ground to long-term lifestyle illnesses, heart disease, heart failure, diabetes, Alzheimer's. Now we have learned that lifestyle medicine and integrative health can help to re-engineer the environment and support health. It's like the contemporary medicine treats the leaves and the branches, masking the symptoms with drugs, removing them with, removing affected limbs with surgery and all of that. But in functional medicine, we treat the root and the soil. We address the foundational issues like nutrition, toxicity, so that the body can heal itself naturally. So when we treat the body by removing impediments, we can restore the body to a state of a whole person health, restoring natural homeostasis. So lastly, lifestyle medicine and integrative health, they are essential for achieving a true whole person health. And that concludes our discussion today. Thank you. And over to you, moderator.
All right. Thank you so much, Dr. Yemi, for that outstanding lecture. Saida, are you going to move on with giving the questions?
Sure, I can going for the questions right now. Thanks for your very informative lectures. We actually hear all those things, but you put everything so nicely back together, so we learn a lot from here. So there are some few questions for you. Yeah, so the question number 1 from Will. Great to hear about the gut microbiomes. Professor Yemi, what is gut microbiome? Do you want to explain a little bit in few minutes?
Can you say the last thing again? Sorry.
What is the gut microbiome?
Okay, thank you. What is the gut microbiome? Now, naturally, in our digestive tract, okay, there are, we have like the probiotics, we have prebiotics, we have things that are embedded. I'm just going to make it, as plain as possible, that are supposed to help us process the food that we eat, remove the waste from there, and also help the body to really absorb the nutrients that it needs. But most of the time, when we alter these microbiomes in our gut, we deal with situations some people might have, like acid reflux. They talk about the leaky gut and all that, and sometimes even the medications that we take, like antibiotics, will interfere with these microbiomes, and people are eating but they are not really getting the full benefit of the food that they are eating, and some of these can even make us sick, right? So some of the ways that we can restore this, eating like fermented food. Some people I think yogurt is one that is very very common that we can eat. Kimchi, some people that like that. Some of those things, I mean, it's all over the internet. So we can eat those things to kind of help. And especially for any reason you are taking antibiotic for, sometimes things do happen. We can, if you are taking antibiotic or your child is on antibiotic, make sure that we're also giving them this fermented food like yogurt. That's easy to find, over the counter, to kind of help reset the gut microbiome. So we get the benefit of the antibiotics, but then we don't mess up the lining of our gut, or reduce the effectiveness of our gut in the process.
Thank you. Very excellent suggestion. So Gloria, sleep is medicine. Yep. A comment. Okay, so another question from Will: how often and how long should we exercise to boost up myokines? Do you have any suggestion for that?
Thank you. I think that is subjective, because we're dealing with whole person health. But many statistics have shown, 30 minutes movement, keeping your heart rate up. And I did mention about dance, right? It's movement. It's not just getting on the treadmill and running, but anything you can do to get your heart rate up. That is what we are talking about. That is what we're talking about here. So we don't necessarily need to go and be lifting weight. Yes, that is good. We've got to do that. But when we are talking with someone they are not even moving at all, you're not going to tell them go to the gym now. You want to start from where they are. What can they do? Do they have a child at home? Lift your child more. Get some bonding time with that child. Do you have walls in your home? Yes, we do. Do some push-up from the walls. You are moving the muscle. Anything we do to contract and relax our muscles will help to release the myokines that will give us this benefit. I'm just being practical, and by all means, if you can hit the gym, please do that. But let's not feel that we have to do all of that. Anything that gets our heart rate up, at least maybe 20% beyond your baseline heart rate, you get some benefits from that. And consistency is the key, not just doing it once a month, but being consistent. A little bit here and there, it does matter.
Yeah. So as you mentioned that 20% up from your baseline heart rate, that's a good key to have every day for at least 10-15 minutes.
Yes, at least, I mean, what you can tolerate.
Okay,
that's why I said we have to make it, yeah. Of course, if you're in the clinic, you are talking to a patient from the contemporary medicine, this is how we say 30 minutes, 5 times a week. But that's the prescription. But when we're dealing with whole person health, what can you tolerate? Where are you right now? If your baseline heart rate is usually in the 60s to 70s, when you put your 20% on top of that, see how you can, how well you tolerate that. Maybe next week, advance it a little bit more, how you tolerate that, so that we give in the body that have been a sedentary state for so long, we give it time to gradually get back to the place where we can be, physically active. So I think that would be the point I want to drive here today, not necessarily reach, hitting a particular number, but gradually moving our body to a place where,
higher level.
Yes.
Great. Thank you. So yeah, from Lydia, so often we overlooked. Yeah, that's true thing. So all these 6 pillars are so important, but we always overlook those. From Bilinga, is a question for you. How is inflammation connected to gut microbiomes, and how can we replenish our gut to have good bacteria through diet? I believe you already mentioned that one. Maybe I can go to the next question. How might or if you want to add something here.
No, that is fine. I think we mentioned the anti-inflammatory benefit of fiber, like high fiber food. That also helps our gut microbiome and also definitely helps to reduce inflammation. So that is an area that I'll maybe add in answer to that question.
Okay, great.
Yes.
So next question from Sujana. How might loneliness contribute to chronic diseases such as cardiovascular disease, depression, or cancer outcome? And also she added, how could a social connection be integrated into cancer care or chronic disease management?
Thank you. To answer this question, I will go back. I don't remember this one of our speakers that gave an example of a lady that had always maybe wanted her family to care for her. If I am recounting that story very well, wanted her family to care for her, and when she eventually got sick and she had a community, her family came around, surrounded her, helped her out, she actually did better with her illness. What I'm saying there is that please, I know that I got that story, but I may not get all the details of it. But that was one thing that stood out to me because it connected to the presentation I was going to be doing today. So loneliness, like we say, it contributes to chronic diseases. Not even looking at the scientific implications of loneliness. Let's just look at it. When you are lonely, you are not motivated to do much, right? You are not motivated to get up and go. You don't have someone to comfort you when you are in a stressful situation. Like we were talking about, stress put our body in a constant state of generating cortisol, which affects our blood sugar regulation, blood pressure regulation. And we also know that when we have high blood pressure, we have the cardiovascular diseases, we have high blood glucose level, those feed the cancer cells in the body. You see the connections now. So loneliness puts us in a state of constant awareness. You are not calm. You are not soothed. You are constantly looking behind you. But when you have people around you that you can lean on, you got a bad news, something happened at work, it's stressful today, you get home, you have somebody to talk to. Or we are in a community, maybe a religious environment, you have a spiritual leader to talk to. All of these things help to alleviate the root causes, right? Help the body to get into a state of homeostasis. And they will say that a problem shared is a problem half solved, right? So when we share the burden, half of it is gone. So it helps us to be able to deal with the other half, which our body is more than capable to handle. So I hope that answered that question.
Yes, thank you so much. I believe we can start our next speaker right now. So Kenneth, would you mind? Oh, okay, Dr. Nagawa, can you read?
I think there's one more question from Samuel.
Okay, so yeah, so there is a question from Samuel, a great presentation. However, given the obvious discrepancies between your presentation and the contemporary treatment model, how would you recommend for clinician facing pressure to move patients quickly through backed up emergency departments and overcrowded outpatient clinics? So this is something. Okay, so maybe you can explain.
Oh, okay. I see the question. I was going to have you read. Yes, to move. Excuse me. To recommend for clinicians to for clinicians facing pressure to move patient quickly. Oh yes, this is a very good one. I don't think we will have time. I don't think we have time to really dissect this, but I will try to compact my response because I've worked in the emergency department as well, in hospital settings, hospitalist, and I see the pressure. But I think what we are doing here these few weeks is very pivotal to getting the knowledge that we need. Excuse me, to get the knowledge that we need. Well, in the hospital settings, you have the case managers, you have the social workers. I think training all the stakeholders, training all the interdisciplinary team on the whole person health, integrative medicine, functional medicine, that will really help, because yes, healthcare, every hour that patients spend in the emergency room, they are, somebody is paying for that. Every additional MRI, every additional CAT scan and all that they do, somebody is paying for it. But if we have a system in the first place to prevent this from even happening, to reduce the amount of people showing up in our emergency room, by keeping people in a state of salutogenesis, as we said, that will help the front end. But when they show up, what we also should be looking at is how can we break this cycle? Looking at that whole person, what are the factors that led to this person coming here today? Is it because we gave them medications that they could not afford? Is it because we did not give them enough education to know how the medications we give them affect, how the food they eat at home affect the medications they take? Is it because they don't have the good support system at home? So when we are able, of course, the doctor may not be able to dissect all that, but I mean, it might take 5 minutes to do that quick assessment. How are you doing at home? What is your support system? Tell me a little bit about what your nationality, or like what food do you eat most at home, right? So it can help us so that we're not just giving information on a generic basis. We can tailor the education to that particular patient, and also have the other other workers within the healthcare system pick up from where we stop. So we are not just sending the patient home back to the same problem that they were having that brought them to the emergency room, but we are making sure that every loop is closed. That when they are leaving, we are not just saying, I recommend you do exercise. What type of exercise? What can that patient handle? And who is able to support them with you see what I'm saying there? So the pressure is there. I know that, I mean, the health insurance, I have some behind the scene information about that as well, how the healthcare insurance system work. Yes, they want us to get those patients out of the hospital, but within this short period of time, having this knowledge that we have now, there are some additional things we can incorporate, and also make sure we connect that patient to other external personnel that we help to continue what we started. The case manager is there. The community healthcare system is there. I mean, I can really go on and on, but I will stop there. I hope that answered your question, Mr. Samuel.
Yeah, thank you so much. And there is appreciation and thankfulness from various listener, Susanna, Oscar, Merle, Belenga, Dr. Belenga, and Vivian. Everybody love these lectures and the knowledge you have, and great presentation. I believe we can go to our next presenter right now. Sure.
Thank you.
Yeah, no, this has been outstanding. I mean, thank you, Dr. Yemi. I particularly liked your case study on Marcos. I think that was a wonderful way to really to bring this home. So I'm going to move on for the next, 20 to 30 minutes. We will have a short conversation, and I'll probably bring you back on, Dr. Yemi, so don't go away too far. So for those who don't know me, I'm Will Ngwa. I'm a global health catalyst. And today I'm going to talk a little bit about, I'm going to have a conversation with some of the leaders who are at the forefront of patient care and on whole person health, and particularly on this topic of lifestyle medicine. As somebody who takes my spiritual life also really, really importantly, I always, when I hear whole person health, it actually takes me back, to the creation story, which people would, for people who are Christians, understand, that, the Garden of Eden, where Adam and Eve were created. I'm also a physicist, so I know the Big Bang Theory, so I know how those things work, but I actually think those two are complementary, they are not contradictory. But if you go back to the Garden of Eden, what you see is this you can call it homeostasis, but you can think about this harmony with nature. So you think about the mental, emotional connections. Adam and Eve, God created Eve. And then the physical health, the spiritual health, the relationship they had with God. They had conversations with God. And then the environment. I would think that environment also includes the microbiome, which Dr. Yemi talked about. And so, all of these things, really integrated together, I believe are really critical to our whole person health. And so, Dr. Yemi already talked about what is lifestyle medicine. So if you didn't get that, I just want to highlight that this is really an evidence-based lifestyle, that looks into, interventions to prevent, treat, and sometimes reverse chronic disease. And we've talked about she's talked about the key pillars, whole food nutrition, physical activity, restorative sleep. When she gave the talk, I realized that, most days I'm probably sleep deprived. Most of us in the US, stress management, avoidance of risky substances, and social connection. Those are the 6 pillars of lifestyle medicine. And as we think through this, we know that many chronic diseases are really influenced by this lifestyle. The conversation I'm going to have is with somebody who is at the forefront of working with diabetes patients. And so we know that type 2 diabetes, for example, prevention and remission can be helpful through lifestyle change. Cardiovascular heart disease is #1 killer in the United States. Improved outcomes in many conditions are related to your lifestyle as well. As somebody who works in the space of cancer, as a professor in radiation oncology, I see the growing evidence that supporting lifestyle approaches can help with cancer survivorship as well. So there is clearly evidence that your lifestyle, we say, like Dr. Yemi said, even for cancer patients, food is the best initial medicine. And so, let's transition from these principles now to have this conversation about how practically this works, right? We've heard the story on the case study of Marcos. But we do understand that lifestyle changes sometimes require, guidance. It requires coaching. It requires sustained support. And that's probably why those social communities to which we belong, whether it's our church, it's our mosque, it's our, whatever social environment that we belong to, is really helpful. But we also know, like if you remember during the COVID-19 period, that nurses were one of they were the heroes for us, right? They are at the front line of dealing with patients all the time. And the front line playing critical roles to help patients adopt healthier lifestyles as well. And so I'm going to transition now to have a conversation with Ms. Edith Moynihan, who is a nurse working closely with diabetes patients to implement lifestyle medicine and taking care of them every day. She is actually, really at the front line of helping patients. She's based in the United Kingdom. So I'm going to start with her, and then I'm actually going to bring back Dr. Yemi, who is also, based on her presentation. Then we can have a conversation, three of us, about, about this. And then I'll welcome questions from the audience so that we can really have this interactively for the next 20 minutes. All right, so without much ado, I'm going to welcome Edith to the podium. Edith, good morning, good afternoon to you. I know you're in the United Kingdom. Can you hear me?
Yes, I can. Good morning.
Yes.
Can you hear me now?
Yes, I can hear you. Welcome. Thank you so much for taking time to join us.
Yes, it's been, I mean, it was kind of a refresher. The talk by Dr. Yemi was kind of a refresher to me. And if I had a slide on my screen, I think she's hit all the buttons there. And it's this whole person thing is the preventative approaches. I mean, I work in diabetes. I work for the NHS. I have to say that I work for the NHS, and one of my
What is
roles.
NHS? What is NHS?
Oh, the National Health Service. We have the National Health Service here. If you are unwell here, you go to the National Health Service. You may not have all the care, but you don't have to pay for your care. So in that way, it's affordable to anybody. It may be slower, but we can all access that care. So that's how we operate here.
Nice.
And
Right.
the National Health Service, one of the things that they do is that if you have they do like Dr. Yemi was talking about the preventative strategies. When I used to work with a general practitioner, one of the things that they do is kind of in diabetes often happens in people over 40. So you have like an over 40 people you do have assessments. You see people who are at risk of diabetes, and then you can try and coach them. Often they have a structured education program, which is like a classroom where people come there. If I want to share one experience that I had there with a patient who came there, and when I looked at her HbA1c, we measure in millimoles per moles. I wouldn't be able to convert it in the American percentage, but she had put her diabetes in remission. So I was it's a group of people who have had a diagnosis of diabetes coming together and having a conversation. And I wasn't expecting her to come. So when she came, I asked her, why did you come? She said she needed something to keep her motivated to keep going, because the lifestyle measures are not easy to sustain. So it's not just about telling somebody what to do, it's about providing them with the tools to keep going. Like we were saying before, yes, physical activity, I can go to the gym twice a week and I do it once in 6 months. That doesn't do the job. So in our structured education program, I do facilitate that course for Desmond. It's called Desmond. It's an international program. They've just changed the curriculum into a new curriculum. And when they look at physical, and they're now calling it physical, 24 hours physical behavior. So we are all sitting here. If all of us have been sitting, can we all stand, please? You need to stand up. See, sitting behaviors. It's about reminding ourselves not to sit for more than 30 minutes. Every 20 minutes to stand up. So we all have the gadgets that can remind us, whether it's your watch beeping to let you know, even if it's just to stand up and walk about. Because we live in busy societies and will not be able to do that. So those are some of the things. And it's about, so you're looking at the sleeping, and we talked about the sleep, talking about sitting, and when we're not sitting all the time. And we can all, in England, we're always talking about the weather. The weather is always bad. So the weather keeps us out. It's a barrier. What can we do? I'm sure Dr. Yemi talked about dancing. Play one of your favorite music on that song that you like and dance to it. By the time you finish, you've done for about 3 to 5 minutes of physical activity. It's about integrating this. How can what small steps? We often talk about SMART targets. What small steps? Taking one thing at a time, and building on that one thing, and building on that one thing until it becomes a lifestyle.
Wonderful.
It's not a quick fix. We like quick fixes today, unfortunately. Maybe I've been going on too much.
Yeah. No, that's a really great segue. I mean, I think that's a great way to actually introduce some of the work that you're doing. And, I really enjoy the idea of, I know in the US, in some offices now, I actually have colleagues who basically do not sit on their chairs. They basically stand while you're working and sit back down, just like you explained, keeping some motion going, not sitting in one position for so long. So that's a really good takeaway from some of what you said. Okay, I'm going to ask a couple of questions to you before I bring Dr. Yemi back. So one of the questions I had was, think about this, in your normal, and again, thank you for the work that you do, because I know most of what the nurses do is underappreciated. You really are the front line. So when you meet a new patient, what is the first thing you look for to understand their lifestyle patterns?
Yes, without understanding somebody, Dr. Yemi mentioned that you are looking beyond the disease. You are looking at the whole person. You ask, why do you think your doctor sent you to me? You have to ask open questions. And it's about building a rapport. When you build a rapport and make that person feel like a person and not just sitting there with diabetes. Why did you think you can just bring a point and say, oh, I have looked at this. This was your HbA1c before now, and it's now higher. What happened in your life that caused that change? And give that patient, the person, the opportunity to speak. I saw a lady with type 1 diabetes, and today's monitoring, you have continued ambulatory blood sugar monitoring with sensors that you wear. It was up and down, and you ask her what is happening that is causing your sugars go up and down. Then you now see the social dimension. Or I have become homeless, or I don't have a job, and they will tell you will see the underlying cause, like they were saying. You are not painting on the leaves, like Dr. Yemi said. You are going down to the roots first, and if you don't treat the roots, you cannot have the green leaves that you are looking for. So it's about asking open questions and making that person know that you are not judging them. Often we just stick labels: diabetes, this one has cancer, this one has high blood pressure. You are talking to a person and not to a disease, talking about a disease. What brought you here? And making them know that you are not sitting here to judge them. You just want to understand them so that you can be able to support them. I tell them that. And they will open up and tell you things that they may not tell anyone else. And then you begin to see where the barriers in their management are and begin to focus on those. So I don't know whether I've answered that question.
Yes. I remember you gave a really wonderful talk at the Global Health Catalyst Summit at Johns Hopkins a few years ago. That was around nutrition, for diabetes. And I think that was a really, a lot of people left that session feeling empowered with that knowledge. I wonder if you can share, can you speak a little bit about nutrition, and how that really is important for us, and maybe even if you have an experience on somebody, a patient who has, through their nutrition, really how that has impacted their health or their whole person health, whether you'll be able to share that.
In today's world, we have the quick fixes, and you may have them in America there. You may hear about Ozempic, or Mounjaro, Tirzepatide. And how do these medicines work? They work by suppressing your ability to eat. They suppress the appetite so that people, we live in a society where there is too much food, sometimes not of the right type. We know that when I would have like in the structure, you are asking, what do you think that cause type 2? What is it that you think causes type 2 diabetes? They will tell you, oh, I was having too much sugary drink, or I was having too much processed food. I wasn't looking at my food labels. People don't cook their own meals. They rely on meals that are out there, and they don't always know what the content of the food is. So when you begin to challenge their thinking, you have people who will say, I don't like vegetables. This is all I can eat. You have to ask them questions to challenge the way they're thinking. Why can't you eat this? You have to challenge them, and they're saying it's not good. I cannot eat any vegetables. And I said, all these vegetables, have you ever tried any of them? So, like Dr. Yemi explained, we all know that eating, in terms of food that we eat, there are many, we are trying to take away the word dietary and call it kind of eating patterns. You can talk about the different patterns, whether it is the Mediterranean pattern. Some people would like to eat in the Mediterranean. You want to explore what is you ask somebody about their food and drink choices. If you ask them to tell you about their food and drink choices, we all have the answers. We know where we are going wrong. And then you ask, is there anything about these food and drink choices that you think may be negatively impacting on your blood sugar or your health? And is there any of them that you, and you're asking them, what is it that you can change? Which of these can you change? And you start building that relationship with them and making them think about what they are eating. A lot of the bread that we eat, bread is a big driver of diabetes, I'm afraid. And it's a quick thing that we are eating. We just grab it on the go and eat and eat and eat. Where people's they have a metabolic problem, eating the bread, you just spike the blood sugars. You ask, how many do you eat? You tell, how many do you eat? I eat 4. How many slices of bread do you think, if you wanted to make a start, how many can you try? And then they will have to make the decision, oh, I will try 3, or I can go on have 2. And then you think about what else can you add to it that will make it not necessarily spike your sugar levels. Then you can think about, it's better to add your fiber in there and add some protein in there in a sandwich instead of just having your bread and jam, because you are adding sugar on top of sugar. Sometimes I am a visual person. I take Legos and I build up a block of sugar cube, a block of Legos. I could have brought it here. And then I make it crumble. And I said, this was your bread. It's now crumbled. While it wasn't sweet when you ate it, when you finish eating it, that's what your body will do to it. Now that you've seen, if you have 2 blocks here and 2 blocks of Lego and 1 block of Lego, which one do you think is better for your body? So it's about challenging people, because they have to make that lifestyle change. You are challenging the way they are thinking. I do have, say, a cohort of the over 60s, over 70s, most especially. They will tell you, instead of just saying, I will add another medicine, you say, when you do these things, you come back to me and we have an assessment. If your sugars haven't improved, then we can think about intensify in terms of medication. And there are many people who come back and their blood sugar, HbA1c has gone down just from making dietary changes. I'm probably going on too long.
Yeah, no, that's great. I like the Lego analogy. I guess the young people who are among us who played Legos can get it. Like, so you build these Legos and they crumble, and you can say, "Wow, yeah, that's a really good analogy of what happens when you masticate, digestion, and all of that stuff." Well, I mean, that's really great. I would like to bring back Dr. Yemi if you're still there. Wonderful. Maybe you can join the panel. I have a couple of questions for you guys before I turn to the audience. So, I mean, again, it was really nice even to hear Edith reference your talk. I think it really set a great foundation for this conversation, Dr. Yemi. So one of the things that I want to ask you guys essentially is, around the barriers. When you meet, from your experiences, what are the biggest barriers to people making these deliberate lifestyle changes that can really have an impact on their health? Interestingly, Edith, you talked about the sugars. Here in the US, it's been in the news about how thinking about taking away the Dunkin' Donuts, the fast food, all of that, right? So that people take, but those things are really, they're delicious, they're good food to eat. Adding vegetables there, like you said, Edith, is a really difficult thing for people to do. So some of these are cultivated habits that people have developed over their lifestyle. So it becomes really challenging to ask somebody to just stop and start eating vegetables. But I would like to hear your thoughts, in terms of, from your experience, what are the key barriers that people encounter when you talk to people about lifestyle medicine, their nutrition, their lifestyle, like physical activity? What are the challenges that make it difficult for them to make those changes?
I want to highlight something here, because one of the things that I say, all of us who are sitting here, when we go away from here, we'll have family that should be our first point of support. Family can be of help, but family can also be a barrier. And
can you elaborate on that? How can family be a barrier? Yeah.
Because if you're eating in a family and other people, you want to eat healthily, and other people bring in the things that you don't want to eat, that you are trying to keep away, then it becomes a kind of a barrier, in the sense that it lures you. A lot of the things, when we don't see them, we don't eat them. One of the strategies that we encourage people to do, if you don't bring the chocolates in, you don't bring the biscuits in the house, if you don't see them, you often don't miss them. But you have people in the house who will bring these things, and they are there, and then you get tempted to consume them. So that in that way. So it's about working. So sometimes family can be of help, sometimes they can be, it's not only family, but the people who are close to you, they can be of help, but they can also be a barrier.
I agree.
And another thing is herb literacy. Like we're talking about breaking down information, herb literacy. I tend to use a lot of visual tools because people don't always understand things. There are cultural barriers. I know people who come from diaspora and we are here and we just want to eat the way we used to eat. And you don't have the sun, you don't have the activity, you are sitting in a car and you don't want to move away from, you only don't want to eat anything Western. You see that, food is a rabbit, you are eating food, is a rabbit, you are being a rabbit. And in some cultures, people are even afraid to talk about their diagnosis because it would be like a failure. So in that way, family can be a barrier. So all I'm saying here is that when we go, we can be an advocate and wrap our arms around whoever we have come across, that we are here to help. We are not here to judge. So that can be a barrier. I'll let Dr. Yemi speak as well, and I will come up with other things that I find as barriers in my area of work.
Yeah, Dr. Yemi, before I have you talk, actually I want to reinforce the family, the social can be and I think that's one of the key components of lifestyle medicine, the social connection. It can also, if it's not managed well, can be counter, right? So, for me as a physicist, we have the law that force, pressure or stress is equal to force over area. So the more you spread that pressure or stress over more people, if you have a community, somebody asks about the loneliness, right? So when you're lonely, that stress is higher versus when you have community. But now when it comes to community, my friend, for example, Oscar, we'll get together, we want to drink, right? We've not talked about the drug use, right? We want to drink and enjoy ourselves, and you take alcohol and all of that stuff. But actually, that could also be counter, right? If you are just, it's tough for you to say no when your friend offers the beer, right? So, that's really true. Anyway, Dr. Yemi, what do you think? What do you say?
Oh, thank you, sir. Great discussion there, Nurse Edith. That was awesome. I could just sit back and listen to all that. Really good. I think one thing I can add to that is education. I think she mentioned that. Education, it goes a long way. I remember I was doing diabetic education for a group of patients, and the average length of time that they've had diabetes, I'm talking over 10, 15 years. And when I began to break it down to them, it was so amazing to me that they have no idea what this disease is that they are dealing with. And they've been going to doctors all these years. They are on insulin, they are on all these oral medications, but they don't know what diabetes is or how it affects their body or what type of food they should eat or not eat. So I think education is very important to let the patient, to let the person, I keep saying patient, to let the person know what this disease is, how does it happen to a person, and you particularly, what are some things that could have contributed to you getting to where you are now? Right, so people don't feel powerless, because sometimes it looks like this big mountain. Somebody comes to the office and we just say, "Oh, you are diabetes or diabetic, or you have diabetes," and we just send them home with medications to take. It's so ambiguous to them. Even the thought of that in itself is stressful, and we're talking about how stress keep all this process going. So it's very important to take the time and break things down for them, and also knowing that when we are dealing with a person, that person is connected to other people. Pull in who are their support system at home. Let us educate all of them together. Now we can do Zoom calls and put everybody together and kind of break it down to them. This is what your loved one is dealing with, and this is how you can help them. Another barrier is the mindset. Some of these illnesses and diseases, we have given them like all these names that it's almost shameful. Like somebody feel ashamed for having this thing, but it's something that happened to them. So I have gone away from saying you are an hypertensive patient, you are a diabetic patient. I would say you are a person living with diabetes. You're a person dealing with diabetes. So that kind of puts them back in charge, that I am a person first. Diabetes is just something that is happening right now. So it helps them to separate themselves from that and be able to deal with that, because it's like if I am diabetic, then if I'm fighting diabetes, I'm fighting myself. You think about it, it's like, okay, this is who I am, I'm diabetic. So why do I want to get rid of who I am? Because that's what we are sending them home with those kind of information. But when you say, no, you are a person dealing with high blood pressure right now, so let us put this on the side. How can we both come together and fight this? And then it helps them. Another area is the nutrition that we talked about. Nutrition is big deal. And many times, since we are talking about diabetes, we talk about what they cannot eat. This, you cannot eat this, you cannot eat that. But how about if we shift from that, because that puts them in, sometimes they will only take it for so long and then the body will rebel. And they will just go on a binge and eat everything because they have lived in a state of deprivation. I cannot have candy. I cannot have bread. I cannot eat rice. And they just get to a point they get fed up with it. A little stress happens and they just I don't care. I'm going to eat everything. And then they come and they come in a state of almost coma with blood sugar at the 500, and you're wondering what happened. And that's those spikes actually hurt the body, hurt the blood vessels more than if they are in a constant state of, a certain range, not too high or blood sugar level. So helping them to see what can you eat, what you can eat, and also just like Nurse Edith was saying, how can you, what your cultural food, how can we make your cultural food that you eat right now, how can we make it a bit healthier? The analogy I give would be, okay, you live in a house, you have this organic farmer on the right side, and you have this person that is just a junkie, just eat all kinds of food on the left side. You are in the middle right now. How can we make your rice that you're going to eat, that if you like to eat rice every day, how can we make it closer to your Farmer Joe on the right side? What can we do to that rice? What can we add to it? So it puts them in control, like Nurse Edith said, adding the protein to it, right? There are studies coming out now that if you put your rice in the fridge overnight or something, it reduces how the glucose is released into the body. I've not done that study, but I've seen a lot of it out there now. So people are, I think somebody actually did a test on themselves that they ate rice that was not refrigerated, that was cooked the same day, and they checked their blood sugar, and then they ate one that was already frozen and they reheated it and they checked their blood sugar, and, but again, everybody is different, so we can't go by that. So, but helping them know, can you add some meat to this, or can you change the type of rice you use? Instead of your white rice, can you use maybe cauliflower rice, things like that. So not depriving the people totally of what they have, but helping them work with what is already in their hand, what they can handle. The only diet that will work is the one that you that you actually commit to. The only exercise that will work is the one that you actually do. So going from just a blanket statement, a blanket strategy, to being individualized, I think that is something that would help. Thank you.
Thank you. Yeah.
And if I can just add, I think one of the issues, like Dr. Yemi is saying, as soon as somebody has a diabetes, that they said, "Oh, I'm being expected to live like a rabbit." We can actually enjoy. It's about, you keep saying, living well with diabetes. We can enjoy lots of food. If you go probably on the American Diabetes Association, I had a look there last night. You go to Diabetes UK, you have seen these beautiful menus that are out there with all the tips that can help you make the rice healthier. You can have half cauliflower and half normal rice, as Dr. Yemi is saying. But I think that one of the challenges is where people don't know how to cook for themselves. Then that becomes they become dependent, and then it's also some of the tools that you get them to do when we are working all the time and we don't have the time to cook. It's little habits like eating late. You come back home and you're eating at 9 o'clock. There will be no movement. There will be no metabolism. The energy balance is going to go wrong. Can I have my lunch, my main meal in the afternoon instead of eating in the night? So it will be little tips like that. So some people who are working and coming home late and eating late, it begins to impact them negatively. Growing up, I remember we even talk about we eat more than we need to. I remember as Will is talking about, I use an acronym FAT, frequency, amount, and time. So you are looking, what type of food am I eating? Then it determines the amount that you need to eat and the frequency with which you need to eat it. And you can talk about how often we eat more than we need to because we are in a rush and eating too quickly. I remember growing up and my mom used to ask us to chew food 20 times. And then you might have swallowed it after the 10th time, but you keep beating your mouth. But that kept you going on and on. If you go to the Mediterranean countries, I have been to Spain, they have a tapas bar. They come and give you a little bit of food and you eat and then you wait before they bring the next bit. When we eat slower, like with the GLP-1s, the medicines that are you are the hormones are in your gut that are supposed to tell you you've had enough. By the time if you eat too quickly, you eat a large portion before that those hormones are triggered, and then you've eaten more than you need to. So it's about even thinking about like the mindfulness we're talking about, chewing your food slowly, really savoring the food. It's not about the portion size. Often we eat too quickly that we don't really appreciate the taste of the food. Eating it slowly and actually enjoying the taste of the food will result in you eating a smaller portion, which is the right portion compared to what we think we really need to eat. Sorry, I've probably digressed.
No, that's great. FAT, fat. Interesting. FAT, frequency, amount, and time. That's actually a really powerful thing. I mean, I was going to ask you the question about whether the time of the day that you eat matters, and you just pointed that, like that's so true. We work all day and then we come back and we want to eat so late before we go to bed. And that's always not the best. Anyway, because of time, I'm going to actually read some of the questions from the chat. Thank you, Oscar, for that great question. You said, Oscar has a question, which goes like this. Does a person's cultural background help to hinder your ability to guide them live a healthy lifestyle through whole person health? So, I mean, it goes back to the culture we are talking about, and I may add to that, are there particular populations, maybe, that you see that from different regions of the world with different cultures that are more prone to, I think we talk about diabetes, for example, and does culture have a play in that?
I think, unfortunately, those of us from the Black and ethnic minority background, we are more prone to diabetes. First of all, because of our genes, and because we grew up in our culture, where we grew up in a society where you ate lots of carbohydrates, the high carb diet, to allow you to walk long distances and walk in the fan and do all these things. And in doing those things, you burnt it. But when we come and live in this society where you are not doing exactly those physical activities, so that is what you grew up eating. Yes, culture, what you grew up eating, it's hard to go away from there. And sometimes other people's, there's a relationship we have with food. What does food mean to us? In our culture, if you visited somebody and they didn't offer you food, that person hasn't welcomed you. But if you want to restrict how much you're eating, that offer of food, if you don't want to eat that food, you are struggling, how can I say no? So in that way, the culture has influenced it. It makes it a little bit difficult. You're trying to be polite because that's how things are done in that culture, but then you are eating more than you need to. So yes, in some ways, Dr. Yemi will probably add to that.
Great. Yeah, that's a great analogy, Dr. Yemi. You want to comment on that?
Thank you, Ms. Edith, for that. Definitely spot on. Culture, I think from the provider standpoint, also being culturally sensitive. I think that is a good, the culture of this person that is in front of you. That is very important. Just like we're just told, some people, if you don't eat, they think you are angry with them or that you are annoyed with them. And then when we go from that is what the type of food that they eat. When I address my patients, I want to know, what do you eat the most at home? Because sometimes I don't want to start with that. What is your most favorite food? Don't go there first. Go with give me a 7 day, let you record everything you put in your mouth over a 7-day period. And we begin to tweak some of those things little by little. Now, there are some cultures that, rice is a big deal in many cultures. And if someone is dealing with diabetes, we know that that's going to hurt them. So instead of saying we'll take it away completely, we can do half and half. Like we said, we can try a different way. The food that we eat, we can actually make food work for us. Like we said, food is medicine. There's a way we combine the carbohydrate, the fat, and the protein that actually will help your body rather than just eating the carbohydrate by itself. And also, what do you do after you eat? You just eat a big bowl of, in our culture, we eat gari, we eat eba, all those food, or potato or mashed potato. You just add all that with the gravy, and you've been sitting in front of the TV all this while. You finish eating it, you just have the kid come and take the plate. You are still sitting in front of the TV. There is no movement at all. Even if you ate a small portion, it's not helping. You've got to get up. So what I tell some of my patients is, after you eat, give yourself like 15 minutes of movement. Just go up and down the stairs, or get up and wash your plate, or do something around the house. That actually helps you. So going back to the culture, knowing what is this culture, what is food, how is food interpreted in this culture, what are the cultural food that they cannot do without, and how can we make those a bit healthier for them. So, and also definitely the education piece as well.
Great.
And just to add there, one of the foods that the swallow foods can be common in some cultures. And while we talk about processing, the swallow foods means that it offers a much larger surface area, and it's easier to break down and to cause the spikes in the glycemia that, like we were talking about. It's not just about the sugars going. The spikes are the things that cause the damage. So it's about thinking, how can these swallow foods, how often should I be eating them in a week? And in what portion size? So that's where my FAT comes there. Thank you, Dr. Yemi.
Thank you.
Yeah, I'm really enjoying this conversation. I think we'll wrap it up in about 5 to 10 minutes. But there's a question from Samuel for you, Dr. Yemi. You mentioned family members' involvement. Have you considered patient privacy implications? And I think that's a really great question to think about. People, the stigma. Sometimes I think one of you mentioned the idea that patients, when that labor on them that they have a particular disease may be something that may be counterproductive. But what do you say, Dr. Yemi, to answer that question?
Yes, thank you for that question, and that is a very important one, especially in the kind of system we live in, where people can sue you for divulging health information. We have all the HIPAA regulations and all that. So that is very important. Now, we're talking about the whole person health. Again, in the whole person health system, the person is the driver. So even the person is the driver in knowing who to share the information with and what information to share. And even your recommendation to them, they have to allow it, right? So all of these, we're not just going to say, I looked in your record and I see these are your emergency contacts, so I'm going to call them and we're going to have a Zoom meeting. No. We'll find ourselves in trouble doing that. So we even sometimes somebody may come with their spouse, and when they got that diagnosis, they want their spouse to be outside of the room when you are talking to them, and that is just fine. Because people process information differently. Someone may have a spouse and they have their friend as their representative when healthcare issues come up. So we have to ask that person, all right, thank you for trusting me with your care. This is what we are dealing with right now. Who do you want me to talk to that can support you? And how much information do you want me to share with that person? And maybe next time they come, they may feel more comfortable talking to other people. Okay, don't let me go into examples, but it is very important to let the person be the driver in that. And that would.
I want to hear the example. I want to hear the example, please.
Okay, sure. So I actually have this. I think she's in her 70s. And she went to the hospital. She lives in a nursing home, right? So she went to the hospital, and really, when she went, she's just been having these respiratory illnesses. We thought it was pneumonia, treated for pneumonia, but just really didn't cure. So sent her to the hospital, coming back to find out she has a metastatic lung cancer, like stage 3, stage 4. So when she came back, actually, when I got that information, I was sad for her, because when I approached her, I approached her with a somber mood, like, oh my, this is not what we were expecting. So of course I'm asking, how are you feeling? Who in your family is aware? Have you talked to your children? And she said, no, actually, she hasn't talked to anyone. But then I said, okay, so who would be your support? Well, it's going to be the children. So a time will come when you cannot make decisions for yourself. So who will be able to make this decision for you? Who do you trust? Then she mentioned her son, but she hasn't told the son. So I'm like, how do we go about this? Then she gave me the permission, she said, to call her son. So when I called the son, and he is asking me, he said, I just asked him, I didn't tell him what was going on. I just said, tell me, what did they tell you in the hospital about your mom's condition? And she said, they didn't tell me much. However, from the way mom was talking, I know it was something serious. And he said, well, it sounded like it could be cancer the way she was talking about it. And I said, actually, unfortunately, that's what we are dealing with. And then what that helped me to do, give me the freedom to be able to share the information with him. And then it gave the family the opportunity, because then he said, we're just going to organize ourselves together. We know she only has a few months to live. We'll get all the grandchildren together. We'll start coming to visit her more often, because we know she has limited time. But in that case, I could have said, if I did not explore further that who in your family is aware of this, who can support you, who can make decision when we get to the point you cannot make decision for yourself, she could have missed that whole thing altogether, because she's scared to talk to her family about this diagnosis. Yeah. So yeah, that's my example.
Yeah, no, that's a really great example. I mean, in my own experience in global health and working in cancer, I've seen situations in Africa where essentially somebody gets a diagnosis of cancer, a woman comes back home and she cannot tell her husband. Partly, I've seen stories where, you tell your husband, a woman tells her husband, telling her husband, and the husband saying, what did you do? What did you do to get this cancer? They actually get, the community looks at them sometimes as if they've done something really bad, or they're a witch, or they did something really wrong. And that just adds to the stigma and to their, so it's a really tough balance. But yeah, that's a really great illustration for that example, Dr. Yemi. All right, so I'm going to make sure we end at exactly on top of the hour, but I do have a question from Stephen. Professor Stephen, actually, Stephen will be giving one of the lectures, be part of the lectures next week on AI with me. So you guys have to come back. So his question is around that. How can we use apps or AI and other technology to help change our mindset around healthy eating? Who wants to take that?
For me, one of the apps that we know that we've got these continuous glucose monitoring devices that run through apps. When I started working in diabetes, when you were having a discussion with somebody about what they eat, they would say, oh, you cannot tell me what you eat. When I see somebody in that situation, I just let them wear a sensor and let that sensor speak to them. And then they will start seeing, oh, this food actually makes my sugars go up. When I eat this is all right. So that is the only way. I'm not very techno savvy. Yeah, I'm still catching up with the apps, but I do use the apps in the monitoring diabetes. In monitoring diabetes, we have these devices, whether it's Dexcom or it's Freestyle Libre, they are all out there, and there are some that actually have AI. I have tried them on myself. Like Dr. Yemi was saying, I put my body as the human lab, and I wear it, and some of those have AI that can actually predict what your glucose will be in 7 hours if you went to sleep. So yes, so we're in diabetes. We are using that to some extent. They are incorporating. A lot of the insulin pumps that people use are using AI. They learn your body and they predict what will happen and they act on your behalf. So that's all I can add there.
Great. Dr. Yemi?
Yes, I think that, that is it right there. There's a lot out today with technology that can really help us. In the area of sleep, like I mentioned, there are things that you can wear. I know we're talking about healthy eating, but they are all interconnected, the whole person, right? So there are devices you can wear. There are watches you can wear. There are rings you can put on that can monitor your heart rate. That can monitor your different levels of sleep. And that will help you to know, okay, this is why I'm waking up, I'm sleeping 10 hours, but I'm waking up foggy-headed in the morning. What can I change? What time of the night do I get my REM sleep? And what is happening usually around that time of the night? So there are so many apps out there. We have the step counters, right? Something to help you know how many steps you walk a day. We have calorie counters as well that we can incorporate to help us. And overall, I will say you have your body. How did you feel after you ate that food? How did it make you feel? Did you eat and you can barely find your bed after you ate? That's because there is, the glucose rush in your body. That's what is going on, which may not be the same for someone else that ate the same food. So yes, there are apps and AI and all that, but the body is still, listening to our body is still the best way to go, in my opinion.
Yeah.
And also using these with caution, because information does one thing to another person and it does another to someone else. Somebody wearing that watch to know how they have slept can get up and see the information. And with AI now, you can find the information. It will tell you all the different reasons why that can be, and that can put you under more stress and create more, whether it's cortisol or all other things there. So it's about, if somebody is looking to use that, they should have some support system where somebody will be able to explain that information to them to avoid having undue stress.
Great point. I am one of the tech people. I think in the future, AI has good and bad, right? So in the future, it will take over a lot of the things that we do. And like Dr. Yemi said, the rings, the watches, all that information, but we have to, be careful how that information, how we use that information. I'm going to take one more question from the chat. And this is actually important because some people, like, I think Muslims are fasting right now, and the Christians lead up to Easter. Some people are fasting. And so this question from Kenneth, it says, for religious communities that practice fasting, what would your advice be on how to fast in healthy ways and how to break that fast?
For the people with diabetes who are fasting, the Quran advises with certain health conditions, they actually advise that fasting may not be the right suitable for you. So if you are working with people and the fasting becomes more of a risk than a benefit, you have to advise, but they will have to take the final decision for themselves. You just offer the advice. I would say that oftentimes you find that a lot of people with diabetes at the end of the fasting process actually have much better blood sugar control. If they were not on glucose lowering medications, including insulins, you actually find that they do have much better blood glucose control because they have not been eating. But also, you have to caution them, because sometimes when breaking the fast in the evening, I think that it's iftar or I think it's iftar. Sometimes they eat too much in the evening, and eating into the night can also have a negative impact. So it's about understanding how much you're eating the sweets, the food that you eat. Too much food in the night can also be not have a very good positive effect. But generally, I would say for most people have worked with, when they go through the fasting period, they actually come out with better blood glucose control.
Dr. Yemi, can I just add
And
something?
if I may add to that, it's also what type of fasting are you doing? How long are you fasting? Because there's a level of fast you can do that you can say, okay, I'm going on a dry fast. But hydration, because our body is mainly composed of water, we need hydration. And, so that has to be put into consideration. And also, what are you breaking your fast with? what type of food are you breaking with? That's also important, because when you are in a fasting mode, your body, like all your receptors are basically like open, waiting. And what you feed them first actually it has greater impact than if you had been eating all day long. So having a well-balanced diet, a well-balanced meal, not too much, not overwhelming the body, the digestive tract that have been dormant all day, that can be detrimental, because some people, they only eat 1 meal a day, but in that 1 meal, they combine all 3 meals of the day and they eat it in 1 meal. So that is actually more detrimental to the body. So education, all of that is very, very essential. So because of time, I will stop there.
This is wonderful. I mean, I think we can continue this conversation. This has been one of my favorite, lectures series for this lecture. So let's please thank Edith and Dr. Yemi. Let's thank them once more. It's really been wonderful. I know there were some additional questions, but because of time, we are going to stop now. I just want to end also by thanking all the people who've worked really well in the background. Ayush, Ari, and all the people, Dr. Gloria, Asaider, thank you guys for moderating this session. Next week, we're going to talk about AI and technology. So, I would really encourage you guys not to miss that one. That's going to be the last real lecture that we're going to be having, besides the practical component of this whole Person Health series. So with that, just want to thank you guys again and wish you all a very wonderful and lovely weekend. Thank you.
Thank you.
Thank you. Bye-bye.
Thank you.